People may faint as a reaction to pain, exhaustion, hunger, or emotional stress. It may also happen after someone has been standing or sitting still for a long period of time, especially if they are hot. When someone faints, their pulse slows right down, but it usually picks up again quickly and goes back to normal. If someone has fainted but doesn't come round after a couple of minutes, then this could be more serious. There are 3 key signs of someone who has fainted. They have a brief period of unresponsiveness, causing them to fall to the ground. They may have a slow pulse. Their skin may be pale, cold, and sweaty. If someone's feeling faint, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulder or a chair if available, to help blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask bystanders to move away, and if you're inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again, quickly open their airway, check their breathing, and prepare to treat someone who is unresponsive. So remember, if someone's feeling faint, lie them down and raise their legs. Make sure they have plenty of fresh air, and when they recover and are feeling better, help them to sit up slowly. If they remain unresponsive, prepare to treat an unresponsive casualty. And that's how we help someone who's feeling faint or have fainted. If this video has been helpful to you, help support St John Ambulance by going to sjA.org.uk/donate.
Little fingers and hands can easily get stuck in small spaces. Sometimes they may get hand or finger injuries such as bruises, cuts or fractures, or they may hurt or sprain their arm or wrist. In the following steps we'll cover hand and finger injuries, then we'll cover forearm and wrist injuries. If your baby has trapped their hands or fingers, these are the things to look for. They may find it hard to move their hand or wrist. They may feel pain in the area. The hand or wrist may be tender and there may be swelling or bruising. If you think your baby has a hand or finger injury, take the following steps. Sit or lie your baby down and try to raise and support the affected wrist and hand. If there is any bleeding, run the cut under cold water first, then loosely cover the wound with a new sterile dressing or large, clean, non-fluffy pad. Call your doctor or see a nurse, especially if your baby's fingernail has been injured or you think there may be a fracture, a broken bone. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. Now we're going to move on to wrist and forearm injuries. If your baby has injured their wrist or forearm, these are the things to look for. The area may be tender and there may be swelling or bruising, and they may feel pain in the area. It can be difficult to know if your baby has a sprain or a fracture, but if you think your baby has a wrist or forearm injury, take the following steps. Remember, RICE. Rest. Help your baby to sit or lie down and support their arm in a comfortable raised position. Ice. Apply something as cold as your baby can bear. This could be a cold flannel, an ice pack or frozen peas wrapped in a cloth. Leave the ice pack in place for no longer than 10 minutes. Comfortable support. You could wrap a soft layer of padding like cotton wool around the area. And elevation. Keep your baby's arm raised with something soft like cushions or a rolled up blanket. Call your doctor or see a nurse if your baby is in severe pain or they can't use their hand or wrist at all. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. So remember, for hand or finger injuries, sit or lie your baby down and raise the injured hand. Wash any cuts and cover the wound with a non-fluffy dressing. Pad the hand with something soft. Call your doctor if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. For wrist and forearm injuries, remember RICE. Sit or lie your baby down and raise the injured arm. Apply ice. Support the arm and keep the arm raised. Again, call your doctors if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. And that's how you treat a baby who has hurt their hands or their arms. Thanks for watching. Help support St John Ambulance. Donate.
If you think someone has had a head injury, There are 6 key things you may find. They may have become unresponsive, even if for a short time. There may be a scalp wound. They may complain of dizziness or nausea. They may have memory loss of events at the time of the injury or before the injury occurred. They may complain of a headache. They may be confused. If you're worried about someone who has had a head injury, you should get medical advice. With someone who has had a severe head injury, you may find that they have had a severe blow to the head, unresponsiveness or a deteriorating level of response, leakage of blood or watery fluid from the ear or nose, unequal pupil size. If a casualty has any of the signs of a severe head injury, seek emergency medical help. To treat someone with a minor head injury, sit them down and give them something cold to hold against the injury, like an ice pack or frozen vegetables wrapped in a cloth. Amy, can you just put the injury? Thank you so much. Assess the level of response using the AVPU scale. Ask yourself, A, is the casualty alert? Are the eyes open? Do they respond appropriately to commands? V, does the casualty respond to your voice? Can she answer simple questions? P, does the casualty only respond to pain? If you pinch the earlobe, do they open their eyes? U, are they unresponsive to any of the above? If they can respond normally, the head injury is probably minor. Keep monitoring their level of response, breathing, and watch for any changes. Treat any scalp wounds like a bleed by applying direct pressure to the wound. When the casualty has recovered, ask a responsible person to monitor and look after them. If a casualty has sustained an injury to the head whilst playing sports, do not allow them to return to the sport until they have been fully assessed by a medical practitioner. Advise them to seek medical advice if their condition gets worse, they're over 65, they've had previous brain surgery, they're taking anti-clotting medication, they've been drinking or taking drugs, or if there's no responsible person to look after them. If you check their level of response and they're not alert, and so you think that they've had a severe head injury, call 999 or 112 for emergency help and tell them that you suspect a head injury. If you can, use a speakerphone so that you can continue to treat the casualty whilst making the call for help. If they're unresponsive but breathing normally, following a head injury, open the airway in the position that they were found, just in case they have sustained a spinal injury as well. This is to reduce further movements to the neck. Call 999 or 112 for emergency help. Continue to monitor the levels of response while waiting for help to arrive. If you think someone with a minor head injury is getting worse, they may show these signs: increased drowsiness, persistent headache, confusion, dizziness, difficulty walking, difficulty speaking, vomiting, double vision, seizures. If you're concerned, call 999 or 112 for emergency help and monitor their level of response. So remember, when treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Headaches are not usually serious and can be treated at home. Common causes include tiredness, stress, an illness such as flu, or exposure to hot or cold temperatures. But headaches can be a sign of a more serious problem, like meningitis, head injury, or stroke. If someone has other symptoms, or it's following a blow to the head, be sure to seek medical advice. If someone has a headache, help them to lie or sit down in a quiet place and give them something cold to hold against their head. This could be a cold compress, it could be an ice pack, or a bag of frozen peas wrapped up in a cloth. Be sure not to leave it on for longer than 10 minutes. For adults, you can suggest they take the recommended dose of painkillers such as paracetamol. For children, you can give them the recommended dose of paracetamol syrup. If someone has other symptoms such as fever, vomiting, a stiff neck and sensitivity to light, be sure to seek medical advice immediately. Or if they become unresponsive, call 999 or 112 for emergency help and prepare to treat an unresponsive casualty. If they have a headache following a head injury, if the headache is not settling or their condition is getting worse, they should also seek medical advice immediately. Remember, get them to lie or sit in a quiet place. Help them to take the recommended dose of painkiller. And if you are concerned, seek medical advice. That's how we treat a headache.
A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs. Pain in the chest, which could spread to the jaw, neck, or arms. Breathlessness. Discomfort in the stomach similar to severe indigestion. Collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack. After you've made the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 mg, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. Try to stay calm to avoid unnecessary stress. If they become unresponsive at any time, open the airway, check their breathing, and prepare to treat an unresponsive casualty. You may need to do CPR. So remember, if you think someone is having a heart attack, call 999 or 112 immediately, help move them into a comfortable position, and encourage them to rest. Give them 300 mg of aspirin to chew and help them with their angina medication if they have some. While you wait for help, keep checking their breathing, pulse, and level of response. And that's how we help someone who may be having a heart attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/.
To bandage somebody's hand, use a roller bandage. Place the bandage on the inside of the wrist, just below the thumb. Wrap the bandage straight around the wrist twice. Then wrap the bandage from the inside of their wrist diagonally across the back of their hand up to the nail of their little finger, straight across underneath the fingers, and diagonally back across the back of their hand to the outside of their wrist. Pass the bandage under their wrist and repeat, diagonal over the back of the hand, across the fingers, and back again. Keep going the same way, bandaging diagonally across the hand like a figure of 8. But each time, only cover about 2/3 of the previous layer. Each new layer should be covering 1/3 of new skin. Make sure you leave the tips of their fingers peeking through. Once you've covered the whole of the hand, wrap the bandage straight around the wrist a couple of times and secure with a pin or tape. To check the circulation, squeeze the fingernail for 5 seconds. When you let go, if the colour doesn't come back within 2 seconds, it means the bandage is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, when applying a hand bandage, use a roller bandage. Make sure the bandage extends far beyond the injury site to ensure an even pressure is applied to the wound. If someone sprained an ankle, knee or elbow, you can use a bandage to support the limb. To make sure you give the right kind of support, bend the joint slightly and apply an ice pack and padding, and then a bandage to help cool and support the injury. You need to wrap it either side of the injury too, to give enough support for the whole area. We're going to demonstrate this technique on an ankle, but you could use it for an elbow or a knee. To bandage an ankle, use a roller bandage. Make sure you have the ankle raised and supported to start with, and then apply an ice pack and some padding. Using the roller bandage, start with the tail and put it to the inside of the foot, and then wrap it around 1.5 times just to make sure that it doesn't come off. I'm just going to lift up your leg a little bit. Okay. It's important to bandage from the toes to the knee because you need to make sure that you cover from the joint before to the joint after the injury site, and then just keep on going around and around. So keep on going until you get to the knee. And then if you can, wrap the bandage around twice when you get to the knee, and then just pin it in place. Does that feel okay? Yep. To check circulation, squeeze the toenail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the bandage is too tight and you need to loosen it off and reapply it. Keep checking the circulation every 10 minutes because the ankle may still swell. So remember, when you're bandaging a sprain, apply an ice pack and then cover the injury with padding. Apply a roller bandage to hold the ice pack and padding in place and to help support the injury. Check circulation every 10 minutes and keep the injury elevated. And that's how we bandage a sprain.
If after performing a primary survey, you find a child who is unresponsive and not breathing normally, call for help. Ask someone to phone 999 or 112 and ask them to bring an AED if one is available, while you begin CPR immediately. If you're by yourself and do not have a speakerphone, start CPR with 5 initial rescue breaths, then 30 chest compressions and 2 rescue breaths for 1 minute before calling for help. To give rescue breaths, open the airway by tilting their head back with 1 hand on the forehead and 2 fingers under the chin. Pick out any obstructions from their mouth to clear the airway, only if you can clearly see something. Keeping their head in this position, pinch the soft part of their nose, allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 5 initial rescue breaths at about 1 breath per second, like this. To do chest compressions, kneel down by the child beside their chest. Place only one hand on the center of the chest. Lean over the child with your arms straight and press down vertically 1/3 of its depth. Release the pressure, allowing the chest to come back up without removing your hand from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast, and to help you, you can sing Nelly the Elephant, which can help you to keep up with the pace. After 30 chest compressions, open the airway and give them a further 2 rescue breaths. Continue to alternate between 30 chest compressions and 2 rescue breaths until help arrives. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get a telephone, take the child with you if you are able. Do not leave the child to look for an AED. The emergency services will bring one with them. If there is someone there who can help, if they have brought an AED, ask them to turn it on and follow instructions while you continue CPR. If they can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruptions to chest compressions. Continue CPR until emergency help arrives and takes over. The child starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally again, put them in the recovery position. So remember, if you come across a child that's unresponsive and not breathing normally, call for help. Tell a helper to call 999 or 112 straight away and ask them to bring an AED. Give 5 initial rescue breaths, then 30 chest compressions followed by 2 rescue breaths. Continue giving 30 chest compressions to 2 rescue breaths until help arrives or the child starts to breathe. And that's how we perform CPR on a child. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate. If after performing the primary survey, you find someone who is unresponsive and not breathing normally, call for help. Ask someone to call 999 or 112 and ask them to bring an AED if one is available while you begin CPR immediately. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR as soon as possible. You will need to start with chest compressions. Kneel down beside the casualty's chest. Place one hand center on the chest and place the heel of your other hand on top and interlock your fingers to lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest to 5 to 6 centimeters. Release the pressure. Allow the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, you can sing Staying Alive. After 30 chest compressions, you need to give rescue breaths. If you have not been trained or unwilling or unable to give rescue breaths, continue with chest compressions only until help arrives or the casualty becomes responsive. To give rescue breaths, make sure the airway is open by tilting the head back with one hand on the forehead and 2 fingers under the chin. Pinch the soft part of the nose and allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. give them 2 rescue breaths like this. Continue to alternate 30 chest compressions and 2 rescue breaths. If someone can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruption to chest compressions. If there's someone there who can help, if they have brought you an AED, ask them to turn it on and follow the instructions while you continue CPR. Continue CPR until emergency help arrives and takes over. The casualty starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally, again, place them in the recovery position, monitor them, and prepare to start CPR again if necessary. So remember, if you come across an adult who is unresponsive and not breathing normally, call for help. Ask a caller to call 999 or 112 for emergency help and ask them to bring an AED. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR. Give 30 chest compressions, followed by 2 rescue breaths. Continue giving 30 compressions and 2 rescue breaths until help arrives or they become responsive. If an AED is available, continue CPR while the instructions from the device are followed by your helper. And that's how we perform CPR. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk if you found someone collapse. The initial assessment is called a primary survey. This is a quick, early assessment to establish how best to treat a casualty in order of priority. We can use the initials Dr. ABC or DRABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. So, when I see a casualty, first, I'm going to check for any danger to make sure it's safe for me to approach them. I don't want to become a casualty myself. Then I'm going to see if I can get a response from the casualty. As you approach, introduce yourself. Ask them questions to try to get a response. If they're not alert and do not respond to your voice, kneel down beside them and gently shake their shoulders. Hello, Amy. It's Winston. Can you hear me? Open your eyes. Still no response? You can pinch their earlobe to see if they respond to pain. Depending on how the casualty responds to you, will establish a level of response. We use the AVPU scale, and each letter can represent the casualty's level of response. A. Alert. V. Response to voice. P. Response to pain. And U is the casualty unresponsive to stimuli. If there's still no response, they are unresponsive. We need to check the airway. Is the casualty alert and speaking to you? You know that there's no problem with the airway. It is clear. If the casualty is unresponsive, open the airway by putting one hand on the forehead and gently tilting the head back with 2 fingers under the chin. Now we need to check to see if they are breathing normally. We do this by placing our ear and cheek over their nose and mouth, looking down the body to see if the chest rises and falls. We do this for 10 seconds. If the casualty is not breathing normally, call for help. Ask them to call 999 or 112 for emergency help and bring an AED. If you are alone, call for emergency help using a mobile on speakerphone and begin CPR with chest compressions. The casualty is breathing normally, so I'm going to check their circulation. Are there any signs of severe bleeding? Look and check down the body. If you find severe bleeding, try to control the bleeding to prevent life-threatening shock. Call 999 or 112 for emergency help before continuing to treat the casualty. You may also need to treat them for shock. I've established that my casualty is not bleeding. So remember, to do a primary survey, follow the order of Dr. ABC. Complete each step in that order as quickly as possible, dealing with any life-threatening conditions as you find them. Call for emergency help. Call 999 or 112. And that's how we perform a primary survey. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk.
If you ever find your baby is not responding to you, you will give them the best chance of survival if you know what to do. If you have found your baby unresponsive and not breathing normally, you will need to perform baby CPR. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. So remember, if your baby is unresponsive and not breathing, call for help. Ask a helper to call 999 or 112 for emergency help. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. Give 5 initial puffs covering both the nose and mouth, then 30 chest pumps with 2 fingers to the centre of the chest. Continue CPR with 30 pumps and 2 puffs until help arrives. And that's how you do baby CPR. Thanks for watching. Help support St John Ambulance. Donate today.
You should use a sling to stop someone's arm moving to protect it and prevent further damage. There are 2 types of sling, an arm sling and an elevation sling, and both can be made using a triangular bandage. The difference between these 2 types of sling is that an arm sling holds the arm in a horizontal or slightly raised position. It treats upper arm injuries, wrist injuries, somebody who can bend their elbow, and also for a rib fracture. An elevation sling holds the arm in a raised position with the fingertips touching the shoulder. It can help support the arm. It can also help control bleeding from the hand or the arm and also help to reduce swelling. To make an arm sling, ask the casualty to support their arm. If you just hold it for me. And then use your triangular bandage and gently pass it underneath their arm and over their shoulder. And leave the long bit facing down. Then bring the top bit around to the opposite shoulder